pretty much across the board look at 70% scanning compliance is the threshold of which you should hit, and they look at that as successful. And we were there, but when you're looking at 70% versus 90, 95%, there's millions of dollars sitting on the table. So we put together this project to increase our scanning compliance to capture that additional revenue basically, and limit, how much work we were having to do to manage the supplies. Because if it's scanned correctly, it just automatically comes over to us for replenishment, and the system works as it's designed to work. One of the biggest factors was just in the leadership. You have to get senior leadership involved, because without them, expecting the improvement and holding people accountable for that improvement, it's not going to happen. I've been in other health systems where we didn't have that leadership, and generally things seem to die on the vine when you don't have that. So the first thing was going to key leadership, senior leadership, getting their support, and then developing a collaborative team. I pulled in our IS resources, our revenue integrity, our nursing leadership, and supply chain, and we all got together and we looked at, what can we do to make this process work, to make this more successful. Change management, it's our human tendency to not enjoy change. It's not comfortable. It's something that you really need to manage well. But once you get that in place, it just becomes routine. It becomes the way you do things, and that's where we've been able to get through the collaboration on this project. And now you talk to the nurses today, they just love it, because their products are always there. They're not having to order, they're not having to lift a finger. It's like going to the refrigerator and pulling out, whatever they need, and it's always there for them. And they can spend their time taking care of patients instead of ordering supplies and managing supplies. And that's kind of been our focus and philosophy for Parkview Health in the supply chain, is let the clinicians are professionals at taking care of patients, and we're professionals at managing inventory. So let's split those two and do what each one of us is our core competencies.